RaDonda Vaught, an ex-ICU registered nurse in Vanderbilt University Medical Center, was convicted of gross negligence resulting in 3 to 6 years in prison and criminally negligent homicide resulting in 1 to 2 years in prison. Vaught was found guilty of the death of 75-year-old Charlene Murphy in 2017 after accidentally giving the patient Vecuronium, a paralyzing agent, instead of administering the drug Versed, a sedative to help the patient relax during her full-body PET scan. An uproar from the medical professionals around the world is circulating the web. Hi and welcome back to my channel. Suppose you're interested in the detailed events timeline regarding Vaught's case in the Vanderbilt Hospital. Then you have landed on the correct video because I will walk you through what happened during the incident straight from the CMS report. December 24, 2017. The patient, Charlene Murphy, was admitted to Vanderbilt Hospital with the diagnosis of intraparenchymal hematoma of the brain, which occurs when blood pools in the brain, headache, homonymous hemianopia, a vision loss of both eyes, atrial fibrillation, which is when the heart beats rapidly, leading to blood clots in the heart, and hypertension or high blood pressure. Charlene was entirely well and was shopping before hospitalization. December 26, 2017. Day of the incident. The patient was scheduled for a full-body PET scan. PET scan, or positron emission tomography scan, is a test that requires patients to be enclosed in a small corridor to obtain imaging for diagnostic and treatment. Charlene Murphy arrived at the radiology department conscious and oriented. Being claustrophobic, she then asked about anxiety drugs during the procedure. At 2:47 p.m., the physician ordered Versed 2 mg to be administered intravenously for the patient's anxiety during the procedure. At 2:49 p.m., the pharmacy verified this order. At 2:59 p.m., RaDonda Vaught took the medication Vecuronium 10 mg, a paralytic in the automated dispensing cabinet, or ADC, in the neuro-intensive care unit using the override feature, instead of Versed, the sedative ordered by the physician. At 3:45 p.m., they called an emergency code on the patient while in the PET scanner. The patient was unresponsive with no pulse. They secured the patient's airway and she was intubated. She returned to the NCU, or neurocritical care unit, after suffering cardiac arrest while undergoing a PET scan. The radiology technician on duty that day was asked how long Charlene Murphy was in the room after the nurse came and administered the medication. The rad tech said they had 30 minutes left in the procedure. They also said they could see the patient from the camera where they were, but only that the patient's eyes were closed the entire time and thought it was only a light issue with their eyes. The radiology technician also added that their cameras are not sharp enough to detect breathing or the rise and fall of the chest. December 27, 2017. Review of the physician's note dated 12/27/17 revealed the physician documented that he discussed the case with neurology and felt that the changes in exam likely represent progression towards but not total brain death. There is also a low likelihood that the patient will neurologically recover, so they decided to pursue comfort care measures. The patient's status was changed to Do Not Resuscitate, or DNR. At 12:57 a.m., they removed the patient from life support, mechanical ventilation, and extubated her. At 1:07 a.m., the patient died. During a telephone interview, RaDonda Vaught described the circumstances leading to the patient's death, and she stated that, "We are halfway through the video, but please don't forget to hit like and subscribe if you find this video of value. I'll be posting more contents like this. Cheers." RaDonda Vaught stated that on December 26, 2017, she was assigned to the patient care role, the help all nurse with an orientee. Another nurse asked her to go to a radiology PET scan to administer the medication Versed to Charlene Murphy as the patient can't tolerate the procedure. They may have to reschedule the scan. Vaught then continued that when she was taking the medication in the automated dispensing cabinet, she used the override function because she cannot find the medication Versed in the patient's profile. While keying VE, she talked to her orientee and chose the first medication on the list. Afterwards, she took the medication out of the ADC and looked at the vial's back for directions on how to reconstitute the drug. She confirmed that she did not recheck the vial's name. After that, she grabbed the patient's sticker in her file, alcohol swabs, and a handful of flushes and a blunt-tip needle. Then, she labeled the medication PET scan Versed 1 to 2 mg, placed the medication inside the baggie, and went to radiology. Vaught stated that the radiology technician was present while she was administering the drug. However, she left the radiology PET scan area after administering the medication. Vaught can't remember how much she gave, but she said 1 milliliter. She placed the leftover medication in the baggie and left the patient in radiology without monitoring. A rapid response was called in the PET scan, and the patient's family was standing outside the hallway and asked, "Ours?" Both Vaught and the other nurse went downstairs to the radiology to check if it was Charlene Murphy. It was indeed Charlene Murphy, and when they arrived, the patient was already revived and intubated. Vaught stated that she told the physician that she gave the patient first a few minutes ago and reminded the nurse practitioner that the patient was awake but unmonitored when she gave the drug. Another nurse then approached Vaught, carrying the remaining Vecuronium vial, and confirmed with her whether that was the drug she had given to the patient. Vaught admitted and said yes. The other nurse then stated, "This isn't Versed, it's Vecuronium." Vaught then informed the physician and nurse practitioner of her mistake of administering Vecuronium to the patient instead of Versed. They asked Vaught whether she documented that they had given Charlene Murphy the Vecuronium. Vaught said, "I did not. I spoke with the nurse manager and he or she told me the new system would capture it on the MAR, or Medication Administration Record. I asked, and the nurse manager said it would show up in a special area in a different color." RaDonda Vaught had spoken to risk management over the phone. January 3, 2018. Termination of employment. RaDonda Vaught went back to the hospital on January 3, 2018, and saw the manager. On the same day, she was terminated. Vanderbilt also sent her to an employee resource counselor for her well-being. According to this report, do you think RaDonda Vaught should be in prison for a medication error? Do you agree that Vanderbilt Hospital, ranked number 20 on the Best Hospital Honor Roll, left RaDonda Vaught to dry? Do you think the hospital, although nationally ranked number 9 in adult specialties and ranked number 1 regionally, had a systems failure that contributed to the incident? Please tell me what you think in the comments below. Thank you very much for watching. Don't forget to subscribe and see you next time.